Well, consider this. Millions of selfies are taken every day by Americans who are obsessed with spontaneously letting others know what they're doing. But what you may not know is that 1 out of every 4 selfie is altered to make the person in the picture look better. A local woman decided that wasn't enough, so now consider this. She became one of the millions of Americans who instead have decided to alter their appearance.
I went on a ski vacation up in Maine this past February, and I took a selfie of myself and did not like what I saw.
Oh my goodness, that's a particularly unflattering picture, though.
Thank you. Might be a little more exaggerated than usual, but that's how I look after I go skiing, and not happy with that.
So she tried over-the-counter creams and cover-ups, and then
it got to the point where all I could do was edit the pictures, and I really don't want to have to do that.
Hello.
Enter plastic surgeon Dr. Edwin Williams. His solution is one of the most popular procedures done in this area, blepharoplasty. Basically, surgery that reduces bagginess from lower eyelids and removes excess skin from the upper eyelids.
What I told Laura she could expect was to look less tired. You know, I use the same line on every patient. I can't give you 20 or 25-year-old eyes, but our goal here is to change the shadowing to just make you look less exhausted.
And there's very little guesswork anymore. Dr. Williams showed Laura Lee this image of what she would look like after surgery.
Years ago, I thought it was kind of gimmicky or salesman-like, and I didn't like it for that reason. But I wouldn't do a consultation without it now, because it really gives me a feel for whether someone's expectations are reasonable.
How would you describe what you hope to achieve here?
Just the bags would be gone. Maybe not gone, 100%, but 99%, and that's good enough for me.
You should feel in about 5 seconds.
So a week later, Laura Lee was in a private ambulatory surgical suite. She was sedated for the outpatient procedure that removed the bags and transferred fat from her thigh to under her eyelids to fill out the hollows. Dr. Williams' work was done in an hour or so, and afterward, Laura Lee would need no more than Tylenol to manage the pain. She was 10 days away or so from her first public appearance.
I don't want to look 20 again. I don't want to be 20 again. I just want to be the best that I can be.
So, of course, we will go back to see what Laura Lee looks like today, and you will get to see the dramatic before and after and hear from her about the recovery. We'll consider that in about 2 weeks here on CBS 6 News at 5. Well, 3 weeks ago, I introduced you to a local woman who hated her selfie so much, she did something about it. No, not edit the picture. Instead, she decided to edit her face. Laura Lee Glindemeyer had plastic surgery done to remove the bags under her eyes that gave her a permanently tired appearance. Well, tonight, consider this, your first look at the results of that surgery and the before and after selfies you have to see to believe. Selfies are a great way to let your friends know what you're doing, but that quick click of a cell phone can reveal a lot more than you want.
I went on a ski vacation up in Maine this past February, and I took a selfie of myself and did not like what I saw.
When we last talked to Laura Lee Glindemeyer, she was consulting with plastic surgeon Edwin Williams to remove the bags that showed up so prominently in that selfie. Her goal was simple.
The bags would be gone. Maybe not gone, 100%, but 99%, and that's good enough for me.
You should feel in about 5 seconds.
A week later, she was under the knife, having the bags removed and her own fat injected to fill out the hollows.
Hey, Laura. How are you?
Now it's 2 weeks later, and Laura Lee is back in the exam room, ready for the big reveal.
Our goal really is to leave patients with a result that you don't see. She's still a little puffy, but overall, terrific result.
Well, you decide. Here's Laura Lee 3 weeks ago, and here she is today. There's still some bruising. Dr. Williams explains her festoons, as they're called, required more work that takes longer to heal. So when you look in the mirror, who do you see now?
Well, I don't see that tired, haggard person anymore. I still have a little bit of bruising. It's only been 2 weeks, but I'm very encouraged with what I see, and I'm very pleased.
But real life and camera ready are two different things, so naturally we asked Laura to take another selfie. What do you see?
I see refreshed, happy. I don't see tired. It's more what I don't see.
Something else you don't see is any reluctance to have her picture taken now.
Beautiful smile.
I'll be honest with you, I have taken a picture of myself every single day since the surgery.
That's unbelievable. When you see the two of them side by side, what do you think?
I'm happy. I'm so pleased.
She is pleased, and don't for a moment think that Laura Lee is an isolated case. A recent poll showed that 13% of facial plastic surgeons had seen an increase in patients who came to them because they were unhappy with their photos on social media. So